Hello ladies and gentlemen, I'm Daniel, my name is Daniel. I broke my arm 2-3 days ago. I came to the International Modern Hospital and I was attended by the doctor Mohammed Kandil. I got a very good service. I was explained exactly what happened in my arm because I couldn't hardly move it. He was doing x-rays, scanners and checking for the best option. He explained me properly the different possibilities. We agreed which was the best one, and now, well, 2 days later, I'm happy to say thank you to Mr. Mohammed Kandil because he did an excellent job. So thank you very much.
For Daniel, if we will see the X-ray post-operative, this is the X-ray post-operative. In this area, this is the head of the radius. This is a metal prosthesis we put. Instead of this one, it was highly comminuted fragments of bone around this area. Due to falling down on an outstretched hand. And as we see, this is the joint, this is the elbow joint, okay? So once this one will be fragmented and highly comminuted, it will fall inside the joint and it will block the movement of the joint completely. So for this case, because it's highly comminuted, so we can't reconstruct it, so we have another option to replace it by metal prosthesis, which is doing very well as a result. We choose the proper size as the normal size for him, and this is the stem of the prosthesis, and it will rotate with the ulna and with the humerus. Okay, for Daniel, what happened with him when he fell down on outstretched hand, we suspect that he will have a fracture of the radial head because of the mechanism of falling down and because the way of inability to move his elbow completely. Okay. At this time, we was worried about radial nerve because the radial nerve is going around this area. Okay, so we did X-rays, we did CT scan. We found that highly comminuted radial head fracture, which is dislocated, and many fragments are going inside the joint, which will block the movement of the joint completely. He was lucky because the nerve was intact and he can move his hand freely, but he can't move his elbow. When I saw this one, so I discussed it with him in details, what is the options we have. We can try to reconstruct the head, and if we can't because it's highly comminuted, so we can do replacement of this part by metal prosthesis. As we see in the X-ray, it's a simple procedure, and we remove these fragments and we put metal prosthesis instead. As you see Daniel now, it's less than 48 hours and he's sitting comfortably, he's moving his elbow, his hand. It needs some time for full recovery for sure because he needs proper rehabilitation. But he will do well.
For sure, I'm sure.